Hello everyone, I'm Dr. Tai from Kaohsiung Memorial Hospital. I would like to welcome you to our Department of GI and Liver Disease in Kaohsiung Memorial Hospital. First, I want to talk about why you should be a gastroenterologist and hepatologist. Gastroenterology is a science of stomach and gut, and a gastroenterologist is a procedure-based specialty. It's a multidisciplinary specialty. You can work with surgeons and pathologists. It needs a huge team effort. It's not just a stomach and intestine. We also include liver, gallbladder, pancreas, biliary, and even esophagus. With the assistance of endoscopy and ultrasound, we can take everything from your mouth to anus. Our department is a well-established center for liver and GI disease. We have 34 visiting staff with 6 professors, 10 assistant, 10 associate professors, and 10 assistant professors. 1 endoscope unit and 1 ultrasound unit with 14 technicians. We have a lot of teaching material and clinical resources. The fellowship in our GI department can do many researches which you are interested in. We also have routine medical conference, seminar, journal reading, and scope readings. You can attend all of these meetings during your fellowship. I want to talk about what you can learn in our hospital. First, in gastroenterology and hepatology, you can learn the gastroenterology with acid reflux disease, peptic ulcer disease, GI tract neoplasm, small intestine disease, and inflammatory bowel disease, including Crohn's disease and ulcerative colitis. In hepatology, you can learn about hepatology B and C, non-alcoholic liver disease, and autoimmune hepatitis. You can learn the liver cirrhosis and the hepatocellular carcinoma. In the biliary, you can learn the gallbladder and the biliary tract disease, including stone, infection, and malignancy. The pancreas, we can learn about the acute and chronic pancreatitis and pancreas cancers. In the GI motility field, you can learn about the achalasia, esophageal motility disorder, gastric motility disorder, and anorectal motility disorders. In our endoscopy center, you can learn the basic technique about the scope, including esophagogastroduodenoscopy and coloroscopy, chromoendoscopy, and magnified endoscopy. You can also learn the therapeutic endoscopy with the polypectomy and the variceal hemostasis, including the esophageal variceal ligation and esophageal injection sclerosis. Non-variceal GI bleeding, you can learn about the use of hemocrypts, argon plasma coagulation, and heat probes. In ERCP, you can learn the endoscopic papillotomy and the endoscopic papillary balloon dilatations. You also can learn about the spyglass pharyngeal endoscopy. In our US teams, you can learn the upper GI and the low GI US and US guide fine needle aspiration and biopsy. In our advanced endoscopic procedures, you can learn about the endoscope submucosal dissection, ESD, or endoscope mucosal resection, EMR. You can also learn the peroral endoscope myotomy for achalasia and the esophageal radio frequency operation, the Barrett's RFA for the Barrett esophagus. You can also learn the balloon-assisted endoscopy for the small bowel disease and the capsule endoscopy. In our GI motility unit, you can learn the myometry and the 24 hours pH test. In our ultrasound center, you can learn the basic technique about the abdominal ultrasound with the real-time virtual ultrasound using the fusing image combined with CT and MRI. You can also have the chance to do the contrast echo using the specified contrast medium for the liver region enhancement. In the therapeutic ultrasounds, you can learn the ultrasound guide liver biopsy, the ultrasound guide ascites aspiration, and ultrasound guide liver abscess puncture or drainage. You can also learn the liver tumor treatment with the ultrasound guide, radiofrequency ablation, and the ultrasound guide liver tumor microwave. Our department can offer a lot of teaching resources with experienced and skilled teachers. We look forward to your fellowship attendance. Thank you and very welcome for your attendance.